We are going to discuss the proper care and wearing of Invisalign here in Oaks Dental Clinic, where your smile is our priority.
For accurate and effective orthodontic treatment, additional aids are required in addition to your Invisalign aligners. In particular, wearing the elastic and using the chewies must be followed as directed to ensure that treatment proceeds as planned. Be sure to wear your aligners for at least 20 to 22 hours per day to ensure accurate tooth movement. If you don't wear your aligners enough, your planned tooth movement may not occur and your aligners may not fit properly, requiring a remake of your aligners and resulting in a longer than expected treatment period. During tooth movement, premature contact of the upper and lower teeth can also occur, and if you experience pain when eating, you may need a bite adjustment. Use an interdental toothbrush as well, as the process of moving teeth creates spaces between them that can trap food. Poorly shaped teeth, recession due to inflammation of the gums, or after a severe misalignment of the teeth can lead to black triangles, the small holes between your teeth and on the gum side of the tooth. All beverages and food except water should not be consumed while wearing the aligners. It is recommended that you replace your new aligners before sleeping to allow for adequate break-in time, and that you store the aligners from the previous step in a separate case in case it is lost or damaged. Because the teeth are moved in Invisalign treatment in the order of creating space and then aligning the misaligned teeth, the alignment of the front teeth often occurs later in the treatment than with traditional braces. If the aligners are seated well on your teeth, your treatment is progressing as planned. There is no need to worry. How to tell if an aligner is up or down. Each tray is labeled with U, upper, and L, lower, with the tray stage number. How to put on and take off the aligners. When wearing the aligners, be sure to press it in with your fingers. When removing the aligners, please remove it from the inside of the molar to avoid deforming the aligner. How to clean and care for your aligners. To clean your aligners, place it in the palm of your hand and gently brush it with a soft bristle toothbrush. You can also use a small amount of toothpaste, then run it under normal to cool temperature water, but not hot water. Be sure to keep your aligners in its case when not in use. To prevent reoccurrence after orthodontic treatment is completed, we use a combination of fixed retainers, thin wires on the inside of the front teeth, and removable clear retainers.
If you are in need of other dental service, choose the Oaks Dental Clinic, where your smile is our priority. Book now.